Have you ever wondered how cardiovascular drugs work? These medications, essential to the treatment of heart diseases, are nothing short of scientific marvels. They regulate blood pressure, manage cholesterol levels, and even prevent blood clots, all to ensure our hearts beat a healthy rhythm. Today, we'll be exploring 4 such cardiovascular drugs: Losartan, Clofibrate, Hydralazine, and Captopril. Each one plays a unique role in maintaining the health of our most vital organ. Losartan, an angiotensin receptor blocker, helps relax and widen your blood vessels. Clofibrate, a cholesterol combatant, aids in lowering lipid levels. Hydralazine, the pressure pacifier, eases the workload on your heart by dilating blood vessels. Lastly, Captopril, the hypertension hero, keeps your blood pressure in check by inhibiting a specific enzyme. So buckle up as we dive deep into the world of these life-saving drugs. It's a journey that promises to be as enlightening as it is fascinating. Meet Losartan, a drug commonly known as an angiotensin blocker. It's a fascinating little molecule that has a big impact on our cardiovascular system. Losartan is a type of medication known as an angiotensin II receptor antagonist. Now, what does that mean? Well, Angiotensin II is a hormone that can constrict blood vessels, leading to high blood pressure. Losartan works by blocking the action of this hormone, hence the term angiotensin blocker. By preventing the blood vessels from constricting, Losartan helps to lower blood pressure and make it easier for the heart to pump blood around the body. But that's not all. Losartan is also used to protect the kidneys from damage due to type 2 diabetes. In individuals with this condition, high levels of sugar in the blood can cause damage to the tiny blood vessels in the kidneys. Over time, this can lead to kidney disease and eventually kidney failure. Losartan can help to slow this progression by reducing the pressure on these delicate blood vessels. Of course, like all medications, Losartan comes with its set of side effects. Some of the most common ones include dizziness, fatigue, and a persistent cough. In rare cases, it can cause more serious side effects, such as a decrease in the number of white blood cells, which can lead to a higher risk of infections, or a decrease in the number of platelets, which can lead to an increased risk of bleeding. It's important to remember that these side effects are not a guarantee. They are potential risks, and their occurrence varies greatly from person to person. If you are prescribed Losartan, it's important to discuss these potential side effects with your healthcare provider so you can make an informed decision about your treatment. Remember, Losartan is a powerful drug, but it's not without its side effects. It's a tool in our arsenal against high blood pressure and kidney damage, helping to keep these conditions under control and improve the quality of life for those affected. But as with all tools, it should be used wisely and under the careful supervision of a healthcare provider. Scene script. Next in line we have Clofibrate, a warrior against high cholesterol. Diving into the world of cardiovascular drugs, we find Clofibrate, a medication that's been around since the 60s. It's an oldie but a goodie, a real stalwart in the fight against high cholesterol and triglycerides. But what exactly is Clofibrate, and how does it work? Well, in layman's terms, Clofibrate is a lipid-lowering agent. It works by promoting the breakdown of fats in the body, specifically triglycerides, and reducing the production of bad cholesterol, also known as LDL cholesterol. In doing so, it helps to prevent the accumulation of fatty deposits in the blood vessels, reducing the risk of heart disease and stroke. It's like a little warrior, fighting off the bad fats and keeping your blood flowing smoothly. But like any medication, it's not a magic bullet. It's most effective when used in combination with a healthy diet and regular exercise. Now, it's important to be aware that while Clofibrate is a hero in this story, it also has its kryptonite. Potential side effects can include stomach upset, diarrhea, and nausea. In rare cases, it can even lead to more serious problems like liver disease, gallstones, or anemia. So, it's crucial to use this medication under the supervision of a healthcare professional, but don't let that scare you off. The fact is, every medication has potential side effects. The key is to weigh the benefits against the risks. And in the case of Clofibrate, the benefits of lowering cholesterol and reducing the risk of heart disease can far outweigh the potential downsides for many people. So there you have it. Clofibrate, an unsung hero in the battle against high cholesterol and triglycerides. It's not new or flashy, but it's been doing its job reliably for over half a century. And in the world of cardiovascular drugs, that's something to be admired. Clofibrate, a true hero in the fight against high cholesterol, but one that must be used wisely. Now let's talk about hydralazine, the pressure pacifier. This unique drug holds a significant place in the world of cardiovascular medications, specifically as an agent to treat high blood pressure or hypertension. Hydralazine works by relaxing and expanding the blood vessels. Imagine a garden hose. If the hose is tight and narrow, the water rushes out with a lot of force. But if you could somehow widen the hose, the water would flow out more smoothly and with less pressure. Similarly, hydralazine helps to widen our body's hoses, that is, our arteries and veins, thus reducing the force with which the heart needs to pump blood. This is its primary mechanism of action. This pressure pacifier is typically used when other medications haven't been successful or in combination with other drugs to enhance their effect. It's a powerful player in the game of blood pressure management, but it's not a solo performer. It's also worth noting that hydralazine is often used in emergency settings to rapidly decrease severe high blood pressure, preventing catastrophic events like strokes or heart attacks. But like every superhero, hydralazine has its kryptonite. Common side effects of this medication can include headache, loss of appetite, nausea, vomiting, diarrhea, fast heart rate, palpitations, and chest pain. It can also cause a lupus-like syndrome characterized by joint pain and swelling, fever, and other symptoms. It's crucial to remember that these side effects don't occur in everyone, and many people taking hydralazine don't experience any side effects at all. However, if they do occur, it's important to consult with a healthcare professional. In conclusion, hydralazine, our pressure pacifier, plays a vital role in the management of high blood pressure. Its ability to relax and expand blood vessels reduces the force required for the heart to pump blood, effectively lowering blood pressure. But like all drugs, it comes with potential side effects and should be used under the guidance of a healthcare professional. Hydralazine, a potent pressure pacifier, but like all drugs, it needs to be handled with care. Last but not least, meet Captopril, the hypertension hero. This mighty warrior is a member of a group of drugs known as angiotensin-converting enzyme inhibitors, or ACE inhibitors for short. Its primary mission? To combat hypertension, also known as high blood pressure and heart failure, a condition where the heart can't pump enough blood to meet the body's needs. So, how does Captopril achieve this feat? Well, it's all down to its ability to block the action of a hormone called Angiotensin 2. By inhibiting the conversion of Angiotensin 1 to its active form, Angiotensin 2, Captopril reduces the volume of blood the heart has to pump, and so lowers blood pressure. It's like turning down the pressure on a high-powered water hose, allowing the heart to work more efficiently. But that's not all. Captopril is also used to treat heart failure. By reducing the pressure inside the blood vessels, the heart doesn't have to work as hard to pump blood, improving its overall function. In addition, it can help to reduce the symptoms of heart failure, such as shortness of breath, swelling in your feet or ankles, and feeling tired. But like all superheroes, Captopril has its own kryptonite. Potential side effects include cough, loss of taste, and low blood pressure. However, these effects are generally mild and often disappear as your body adjusts to the medication. Severe side effects are rare, but if you experience symptoms such as swelling of the face, lips, tongue, or throat, difficulty breathing, or severe dizziness, seek medical attention immediately. Captopril, an effective tool in the battle against hypertension, but remember, every superhero has its kryptonite. So, there you have it, a journey through the world of cardiovascular drugs. We've navigated the diverse landscape of these medical marvels, from the angiotensin blocker Losartan, a lifeline for those battling hypertension, to Clofibrate, our trusty cholesterol combatant. We've also delved into the workings of Hydralazine, a pressure pacifier that soothes the turbulent tides of high blood pressure. And of course, we can't forget the ever-reliable Captopril, our hypertension hero, ever ready to spring into action when blood pressure levels rise. These drugs, each unique in their function and mechanism, underline the complexity of cardiovascular health. They highlight the importance of proper usage and adherence to medical advice, as they play a crucial role in managing and improving the lives of those with cardiovascular diseases. In this ever-evolving field of medicine, the value of these drugs is undeniable. Subscribe for more, because you won't find me later.